If I may say so, I am profoundly sorry for the impact that had. I'm profoundly sorry for each death that has occurred.
A warm welcome to another Essential Quinn Talk today. Today, my subject matter is Matt Handcock, the UK Health Secretary during a recent virus pandemic, and in particular his attendance at the UK government's inquiry into the same event. Now, Mr. Handcock had to resign from the government under dubious circumstances, and I want to share some information with you regarding the types of mistakes that Mr. Handcock made and the effect they had on the elderly population of this country. But first, let me share a number of clips with you which will set the scene for this.
Yesterday we had evidence from Matt Handcock, the former health secretary, during that pandemic period until he got sacked for having his hand on the backside of his lover and aide in the Department of Health. And at that Covid Enquiry, he had a number of things to say which amazes me, still manages to shock me. He said to the Covid Enquiry that really the UK should have locked down sooner and we should lock down again. This is what he had to say about pandemic planning.
We've got to be ready to hit a pandemic hard, that we've got to be able to take action, lockdown action if necessary, that is wider, earlier, more stringent than feels comfortable at the time. And the failure to plan for that was a much bigger flaw in the strategy than the fact that it was targeted at the wrong disease.
Absolutely terrifying words. If that does not chill you to the bone, then frankly you're not paying enough attention. Someone who's definitely been paying enough attention is a journalist, Talk TV's international editor, and of course the whistleblower behind the lockdown files, Isabel Oakeshott, and she joins us once again today. Good morning to you, Isabel.
Morning. I mean, there is one reason to be a little bit less terrified, and that is that I don't think anyone really takes Matt Handcock seriously anymore.
Into the job, I had some experience at a more junior level of dealing with crises and emergencies, and so I took my responsibilities as the principal responder to a pandemic very seriously.
It is the Department of Health and Social Care that is the lead government department. In effect, it is the department in the driving seat.
Yes, and as Secretary of State, I felt keenly the responsibility as essentially the lead responder in the first instance to those sorts of health emergencies, and it was a part of my day-to-day work because these emergencies happen from time to time. If I may say so, I am profoundly sorry for the impact that had. I'm profoundly sorry for each death that has occurred, and I also understand why for some it will be hard to take that apology from me. I understand that, I get it, but it is honest and heartfelt, and I'm not very good at talking about my emotions and how I feel, but that is honest and true.
I hope you found those clips regarding Matt Handcock's time in government as Health Secretary interesting. What comes across to me is the ineptitude of the man and his lack of experience for such a senior role. Isn't it very much the case today that those full of hot air tend to float to the top and they get into positions which they are not capable of doing or making the right decisions? Now I want to show you a chart I have prepared showing a period in Matt Handcock's time as Health Secretary in which a major decision was made that had serious consequences on the lives of our elderly people. And here is the chart I want to talk to you about. This data represents England and Wales in the year 2020. The black line represents death rates at 5-year average levels. This is an international benchmark standard. The green area under the chart represents the 5-year average plus the excess deaths due to the pandemic virus. And the red line, this is actual deaths in that year itself. You see here in the early weeks and months of 2020, the red line is below the 5-year average, so that's very good. Then we get into the period when the virus hits, and we see that this red line has risen greatly in excess of even what was expected, given the number of people dying from this new and deadly virus. Now, why would this be so? Well, the reason for this is directly related to a decision made by Matt Handcock in March 2020. Matt Handcock ordered that sick and infirm elderly people resident in hospital beds should be discharged to free up beds for expected virus patients. These people were then transferred out of the hospitals without any testing for whether they had the virus or not, and they were placed back in the care homes from which they came from. Now, remember, these people were in hospital because they needed treatment, not because they needed dumping out. And some of these people may have had urine infections, a minor stroke, or just needed some special medical attention, but otherwise would, in a few days, be discharged back to the care home. So what happened is that during this period, all of these people, maybe hundreds of thousands of patients, were discharged back to care homes, prioritizing those expected to come in sick with the virus. Now, the effect of this was to create a spike in death rates. Many of these people, not in receipt of the care and attention they needed, expired sadly when they returned to the care homes. And this decision is directly Matt Handcock's responsibility. And here we have an article in the British Medical Journal published on the 29th of April 2022, reporting on a court case taken against Matt Handcock by two people who lost loved ones. This case found that Handcock's decision was irrational. Further, it says he operated an unlawful policy, giving the lie to his claim to have thrown a protective ring around care homes when the pandemic struck. Now, the area between the red line and the green area, this represents some 21,000 people, in excess of expected deaths. At the Covid Enquiry, Matt Handcock made no reference to these additional 21,000 patients, someone's mother, someone's father, grandfather, grandmother, a cherished uncle, a cherished aunt. He made no reference to these people who died because of his ineptitude and his bad decision making. These were people who needed to be in hospital, and he booted them out. Now, that is a very heavy weight on a man like Matt Handcock. Or is it? I believe it should be. But if you note his performance, and it was a performance, he just wanted to pass the buck, blame the government's pandemic planning. Blame it on not locking down earlier, harder and faster, even though countries like Sweden, who didn't lock down, have proved the lockdown was the wrong decision and has led to a catastrophe in healthcare in this country. So there you have my summary of Health Secretary Matt Handcock and his performance at the virus inquiry. It's a very, very sad state of affairs when we see that our politicians have been of such a low caliber, inept, inexperienced, and full of pride and boasting of their abilities. I'll leave this to you. Let me know what you think. Am I unfair on Matt Handcock? Do you think he did a good job? Please leave me your comments and let me know what you think. Thank you for watching. I hope to see you again soon.